Mrs. Bhagya Prasadinie, Hewa, Lunuwilage, BSc in Physiotherapy in Columbia University. Mrs. Bhagya Prasadinie is an AHPRA registered physiotherapist working in relation to geriatrics and community fields in Australia. She holds a bachelor's degree in physiotherapy from the Faculty of Medicine, University of Colombo. And she obtained her postgraduate diploma in health development and research at the University of Colombo. She is a former physiotherapist at the National Hospital of Sri Lanka. And also she has contributed to the curriculum implementation unit of the Faculty of Medicine, University of Colombo. And Mrs. Bhagya has contributed to several community-based research on non-communicable disease, including rheumatoid arthritis and work-related MSK diseases. She has obtained a specialized training in Australia regarding manual handling and falls prevention. And she has been the resource person in safe manual handling session in several aged care facilities. And I would like to mention that today she is on cutting edge technology in patient transferring and restoring mobility. So Mrs. Bhagya Prasadinie, this is your opportunity to raise your voice.
Thank you so much for introducing me. Good evening, everyone. My topic is cutting edge technology in patient transferring and restoring mobility. So is it all right if I share my screen? So yes, so first of all, we'll have a look at what mobilizing and transferring means. So functional mobility is a capacity to move from one position to another, enabling participation in normal daily routines and activities. So there are three main areas of functional mobility. The first one is bed mobility, that is rolling on the bed and getting from lying to sitting. So those transitions are considered as bed mobility, and transferring means from a from a sitting position to another sitting position, or lying position to another sitting position, or sitting position to a standing position. So ambulation means how you move from one place to another. So next, we are going to, in order to, this is like, I'm just touching the basic theory part a bit, because in order to understand the technology, why we use this technology in the developed countries, we need to understand what are the issues they have addressed in introducing such technologies to their countries. So usually a mobility assessment of a patient determines how much a patient can move, so that we need to assist the rest of the movement so that he or she can contribute to the transfer or like ambulation properly. So what equipment or assistive devices will be necessary for them to complete a task, daily tasks such as walking, toileting, and etc. And as I say, how much support the caregiver must give or provide the patient if he or she is having limitations. So we have categorized the mobility depending on level of assistance. The most if you do not need any support at all, we call it independent. And supervision is sometimes you can supervise the patient when he or she is transferring or moving, but you do not need to provide any assistance in particular. Standby assistance is you need to stand by the patient, and you need to have a little bit of awareness of the patient's movement. And minimal assistance is you can give a little hand of assistance for the patient to move, and moderate, like if the patient can do at least like nearly 25% of the movement, and the rest of the movement is the care is providing in minimal assistance. So moderate assistance is half-half. Like if the patient can do half of the movement, the care is providing the rest of the movement. So maximal assistance is we need to provide the entire assistance for the patient in order to transfer or like ambulate into another chair or bed or anything. Okay, so next we are moving on to the transferring equipments and techniques. So first is slide sheets. Now slide sheets, I'm starting the this section based on the dependence level, that is the assistance level. So I'm starting with the dependent part, that is maximal assistance. So maximal to moderate assistance. So when a patient cannot move by himself, we use slide sheets to move the patient up and down on the bed. And sometimes we use the slide sheets to transfer the patient to a trolley or another bed in order to move the patient in a horizontal plane. So usually in Sri Lankan context, I have not particularly seen the slide sheets being used. The slide sheet is polypropylene sheet. It's sort of a cloth. So we use 2 sheets, or sometimes we use tubular sheets. So in the next slide, we will see some videos regarding that. So what we do is we just place 2 sheets under the patient, and we move the first sheet, the top sheet. And when we move the top sheet, the weight of the patient, we cannot feel the weight of the patient because the 2 sheets are sliding on each other. That is why we call them slide sheets. So we'll see a video on that. So you can see the patient can move himself up and down. And when we want to turn the patient, we can easily turn using the slide sheets. Now, this is a tubular one because we don't use to, here it's just a tube sort of a sheet. And yes, so next we are moving on to the transition from a bed to the chair. So in such cases, we use ceiling hoists. So this ceiling hoist needs to be put up on the ceiling. So there is a specific track which the machine goes, and it is all it's all power controlled. So the right side image is a sling. That is what we use for the patient to connect to the machine. So basically, with this machine, we can lift a patient, we can lift an unmovable or like immobile patient to a chair or a wheelchair or whatever the mobility, whatever the sitting position is. Because usually in Sri Lankan context, if the patient is immobile, we do not, it's quite hard for us to transfer a patient to a sitting position. But here we have these sort of equipments. We'll discuss some more equipments later on. This is how we transfer a patient with the ceiling hoist. So you can see we attach the sling under the patient, and we attach the sling to the hoist up on the track. So with the remote controller, we can control the transition, like taking the patient up from the bed and putting the patient down and everything. So I'll quickly move on to a quick video regarding that. I hope you can hear. So this is how you take, this is the track I have talked about. So you can perform this action with one person, but in the clinical setting, in the hospitals and aged cares, of course, we always advise the carers to use 2 people, because one needs to handle the machine, whereas the other one needs to hold the resident or the client. Because, see, so these ceiling hoists can be administered in the bathroom as well, so that they can be transferred to the shower chair or commode or anything. Sometimes they do have the ceiling hoists. They build up the ceiling hoists even to the visiting rooms. That is actually part of the occupational therapist. So they all design, they discuss with the patients and design what are the areas the patient needs to access, and with that the ceiling hoists are designed. So next we are moving on to the portable hoist, and this portable hoist, sorry, just give me 1 minute. Yeah. Yes. So this portable hoist is doing the same mechanism as the ceiling hoist, but the difference is this portable hoist does not need to be like placed in one place. It is very mobile. You can take it anywhere you want, so that the patient can be transferred from the bedroom to the living room or wherever it is. You can just transfer the patient on even surfaces. So we can use the same sling as the ceiling hoist for this. So we will quickly go through. So this is how you can attach the sling. So, the sling has loops so that you can attach to the handle of the hoist. So this is how you attach the sling to the portable hoist. In all these things, we need to introduce the movement technique to the client, to the patient. So you can see that this is particularly a toileting sling, because some of the slings, there are various types of slings that is to take the patient up from the sitting position or lying position. So this sling, of course, it has, so the back support is very less in this sling, so that can be used for toileting as well. So there are some slings that extends from the shoulder level to the tailbone level. So yeah. Okay, so ceiling hoist and portable hoist both can be used as gait training devices. So as you can see here, you can usually what we do in Sri Lankan context is we just lift or like we assist the patient to stand up, and we try to do certain movements, but there is a risk of falls, and there is a risk for the therapist as well, because holding another person or having another one's weight onto you is not safe for you as well. So here you can see the ceiling hoist can be used for balance training as well as gait training. So next we move on to the standing hoist. That is again, now the ceiling hoist and the portable hoist we usually use for the people who cannot move by themselves. Yeah, so usually these people, we call them if they don't have the trunk control and the leg control, we usually use the ceiling hoist. That is most maximal with the clients or the patients with maximal assistance and the moderate assistance. So for the people who are having moderate assistance, like moderate to minimal assistance, we use the standing hoists. So with the standing hoist, you can get a resident up from the sitting position to the standing position. So this is called as sit to stand lifter and standing lift as well. So we'll quickly go through the video. So you need to be sure that so you can see the patient needs to have proper trunk control to use this machine. And the patient needs to have some sort of leg strength in order to maintain the standing position. Yeah. So with the controller, you can lower the patient properly to the bed. So when you need to when you're using this machine, you need to make sure that that your patient is having proper leg strength to use the machine. And if the patient does not have the leg strength, or like especially the balance, I'm sorry. So especially the balance issues, if the patient is having balance issues, of course, we can use this machine with the leg strength, proper leg strength. Okay, so next we are moving to the SARA study. So SARA study or the patient mover is again a manual one. The machines or equipments we have discussed so far are all powered ones or electrical ones. So the SARA study is a manual one, and it operates through leverage. So the blue color, there are two hip plates, as you can see, and the knee plate. So the patient should be sitting on the hip plates, and the patient can hold the bar handles and stand with their leg strength. And after they stand up, they can place the hip plates and take the patient to the desired destination. So, so you can see the patient is standing up with her leg strength, and she does not need to stand for a long time. She can just have the impulse to stand, and after that, she can sit on the hip plates. And yes. So for this, of course, the patient needs to have the proper leg strength. So this comes with minimally assisted patients, and the patients who has some sort of capability of performing the standing movement. So next we are moving to we are moving to the patient transfer chairs. So these chairs you can use as a mobility aid for the people who are less mobile, and sometimes people who have undergone surgeries. So these are, there are two types, hydraulic and electric ones. So the one shown here is hydraulic one, sorry, electric one. We'll quickly go through. Okay. So you can see, you can detach the hip plates, and you can see this one is a hydraulic one. And yes, so you can make the patient sit, and you can slowly place the hip plates under the patient. So you can lock everything just to make sure if the patient is safe. And with the hydraulic lever, you can lift the patient up and transfer the patient to the toilet or to the seating area or wherever you want to. So the next one we are moving on is the sit hoist. So this one is purely manual, and again, this does not need any power or electricity. This is purely lever based. So as you can see, the carer is pushing the lever down, pushing the handle down, so that the resident is coming up. So usually this is ideal for the sit-to-sit transferring, like taking a patient to the toilet or making a patient sit on a chair or a couch. So this is how you do it. Yes, so you can see that it's less discomfortable to the carer because usually toileting is a major issue we face when we are addressing the patients. So this will be a good option even in Sri Lanka if we can facilitate, because this does not need to be like there are so many new innovators in Sri Lanka. So if one can just develop something like this, I don't know whether there are in my as I have experienced, I have never seen. So this does not need to have a lot of technology. It's just the levering systems we need. All right. So next we are moving on to the mobility equipments. Now, so far we have discussed about the transferring, how to transfer the patients from the lying position to the sitting position, and from the sitting position to another sitting position. Now we are talking about the mobility equipments and techniques we are using here in Australia. So this is a mobile air chair, or in simple terms, we call it a princess chair. So this, of course, some of the private hospitals in Sri Lanka also have these. So this is an air cushioned chair, which if a resident is bedridden, so if the resident cannot be sit on a proper chair, this can be used. Usually in Sri Lankan context, all the bedridden patients are like, they are lying on the bed all the times. But this type of chairs can be used to facilitate their mobility. So you can use this for indoor mobilities. And these, of course, I think we have in Sri Lanka to some extent tilt-in space wheelchairs. So tilt-in space wheelchairs, we can, it's just a normal wheelchair with the tilt-in space function. That is, we can tilt the chair as well as we can angle the backrest as well. So usually the normal wheelchairs, we don't have the backrest angulation in Sri Lanka as far as I see. But in this one, of course, you can angle the footrest, as you can see here. You can angle the backrest, and you can angle the entire seating position. So next, the most important, powered wheelchairs. Some of the Sri Lankan context, I have seen powered wheelchairs. So these electric wheelchairs are used with electric power, and we can use these wheelchairs indoors as well as outdoors. So there are two types of mobility devices as such. this one is a powered wheelchair, and there is another one called mobility scooter, which we will discuss in the next slides. So this powered wheelchair, you can have a look how it works. You can lift the chair as well if you want to. And see, with a person who cannot be mobile, having this sort of mobility device permits, allows the patient to travel to anywhere he or she wants. So I need to emphasize this, along with these things, the access points to each and every building is a must. So we just do not like, it does not give much sense having all these equipments if we do not have the access points to the buildings or like public places. So here in each and every train and bus and public transport, wherever you go, you can clearly access wheelchairs or any mobility device. So that I need to, yes. So these are the mobility scooters, much more similar to the powered wheelchairs. So the difference is usually the mobility scooters have a more, what do you call it? More range in performing the movement. And this is quite good when you are mobilizing on the road. So it's just like a normal bike we ride. We have mirrors to see both the sides. So you can hover and navigate it to anywhere you want. So you even have signal lights from the to left and right. Yes. So next we have move on to the forearm support frames or gutter frames, we call them. This is now the previous all mobility aids we use for less mobile or almost immobile patients. So this forearm support frame we can use for the people who has the upper limb strength but does not have the trunk strength or the leg strength to maintain the standing position. So next, we move on to the four-wheel walkers. Of course, here in elderly people, almost all the elderly people use four-wheel walkers. So it's amazing because when we get onto a bus, we can see people with four-wheel walkers inside the bus. So, which of course in Sri Lanka, we even do not use this type of things, even for inside mobility. So you can go shopping, you can do anything with the four-wheel walkers. So you have a bag, you can put your belongings there. And see, you can you can easily put it on a car, inside a car as well. So you can, if you're tired, you can just sit and have a rest. So yes. So sorry. So these sort of mobility equipments are not that much expensive in Australia. So in Sri Lankan context, it would cost around 2,000 to 3,000, maybe. So so these are quite reasonable price. This has quite reasonable price ranges as well. So this can be used as a mobility assistance if the patient has a proper, if the patient is mobile and independent. We even call these people independent because they can move from one place to another by themselves, and they just use this equipment, this mobility aid, and they do not need anyone's assistance for them. So so next we will move on to the walking belts or gait belts. I don't know whether we have in Sri Lanka. So this is the for independent patients, and when we are doing gait training, we use these gait belts or walking belts to hold the patients. So I think my colleagues have experienced this a lot, because we have, when we get the stroke patients, we do not like for them to re-educate the walking pattern, gait pattern. We do not have a particular device to make them stable while standing. So with these gait belts, we can hold the patient to ensure the patient can stand and do balancing exercises and practice their gait. So now we have come to the end of the presentation. So yes, if you have any questions, I'm more than happy to answer. Hello? Hello? Can you hear me?
Yes. Yeah, we can hear you.
I'm happy to add some idea from Sri Lanka. Even though it's really interesting lecture, and it's really happy to have you to have these ideas. In Sri Lankan setup as a physiotherapist, we have I think you know already, we haven't that sort of facilities with us. We have to manually hold the patient, manually transfer the patient, and as physiotherapists, we have much involvements in our back disciplines, because we have to have those everything in by hand. So that's a somewhat problem in Sri Lanka. Anyhow, at the end, as you mentioned, we are just using some sort of bed sheets or some sort of wrapping instruments manually made things instead of these machines because of the high cost of the things. And if in the near future or in the recent future, if we have this sort of equipments in Sri Lanka, it'll reduce the burden of physiotherapists in Sri Lanka. Anyhow, thank you so much.
Yes, thank you so much. And yes, I agree with you, because all these technologies, they need to, like, some of the things I have shown you are actually just not need any, like, much more technology to develop. So if any inventors, or if we can get the support from the ministry to provide us with this type of equipment, would be great. Thank you so much.
Okay. Okay, thank you so much, Mrs. Bhagya Prasadinie, our guest lecturer, AHPRA registered physiotherapist, Apex Health Professionals, Melbourne, Australia. Actually, madam, your lecture on cutting-edge technology in patient transferring and restoring mobility was very informative, very interesting, as well as very important. So thank you once again for joining with us and sharing your knowledge with us. Thank you very much. Okay,
Thank you
now,
so much
ladies
for
and
giving me
gentlemen.
so much.
Okay, okay.